Are you taking more than 5 medications a day? It may be time for a review. In this video, we're going to talk about polypharmacy. Polypharmacy may not be a term you hear every day, but it affects many people, particularly older adults or those living with long-term health conditions. Polypharmacy refers to the use of multiple medications by one individual. It typically means taking 5 or more medicines at the same time. In an ageing population, this applies to a large number of people. The Royal Pharmaceutical Society describes polypharmacy as a serious and growing public health challenge. As people live longer and develop multiple conditions, the number of medications prescribed often increases. This is especially common after a hospital admission. Taking more medicines increases the risk of side effects, medication errors, and interactions. So, when is polypharmacy a concern? Some polypharmacy is appropriate and necessary. However, in some cases it can become excessive or unsafe. Problematic polypharmacy happens when the potential harm of taking several medications outweighs the benefits. It can also occur when the individual does not understand what the medicines are for, how they work, or the impact of not taking them properly. Let's look at what causes problematic polypharmacy. There are 2 common reasons why this happens. One is when a person is under the care of multiple specialists. For example, someone may be seen by a cardiologist, a diabetes team, and a gastroenterologist. Each specialist may prescribe medication for their specific condition, but may not be fully aware of what the others have prescribed. This can result in duplicate treatments, interactions, or unnecessary medication. The second reason is that some medications are prescribed for short-term use only, but are never reviewed. Over time, they remain on the repeat prescription list, even if they are no longer needed. A real-life example involved a woman in her late 80s who moved into a care home. She was still taking folic acid despite not having had a folate test in years. After some investigation, it was discovered that she had originally been prescribed it during her pregnancy over 40 years ago, and it had never been stopped. So, what should you do if you encounter a case of polypharmacy? If you or someone you care for is taking several medications, it is worth contacting the GP surgery to ask for a review. Most GP practices now have pharmacists who can carry out a full medication review. These reviews look at the overall picture, not just prescriptions from one clinic or department. You can phone or visit the surgery to request a review with the pharmacist. In some cases, the GP may also refer you to a hospital-based polypharmacy clinic. Since October 2020, anyone taking 10 or more medicines qualifies for a structured medication review. If this applies to you or someone you support, ask the surgery to arrange one. Let's look at a case study to illustrate how polypharmacy can build up quickly. An 80-year-old woman who had originally been only taking paracetamol was recently found to be on 5 different medicines that had been introduced over just a 2-year period. These were ibuprofen, amlodipine, furosemide, oxybutynin, and macrogol. Only one of these medications was originally prescribed to treat her condition. The others were added one after another to deal with the side effects. She was first prescribed ibuprofen for arthritis. Regular use of this ibuprofen then raised her blood pressure, so she was started on amlodipine. Amlodipine caused swollen ankles, so furosemide was added to reduce the fluid. This led to urinary frequency, which affected her quality of life, so oxybutynin was introduced. Finally, oxybutynin caused constipation, so macrogol was then prescribed to manage that. This example shows how quickly a simple medication regime can grow, sometimes unnecessarily, and highlights the importance of regular reviews. If you are concerned about polypharmacy for yourself or someone you care for, speak to your GP or pharmacist. A thorough review could reduce the risk of harm and improve quality of life.